In the span of 2 months, San Diego has moved from the CDC's low-risk COVID tier to now at high risk as the more contagious BA.5 variant drives up cases and hospitalizations.
It's impossible for us to say exactly where this will peter out to, but I think it can be said right now that we are moving in the wrong direction. We want to try and put some brakes on it.
Dr. Cameron Kaiser is one of San Diego County's deputy public health officers. He says with all the at-home testing, the spread is likely larger than we know. That's where wastewater testing comes in. The amount of COVID in sewage has proven to be an early indicator of when cases are rising.
And unfortunately, the wastewater amount is also slowly creeping up as well, which indicates we are not near this peak.
There's been multiple days this month where more than 2,000 new infections were reported. The increases are prompting some to reconsider targeted interventions to mitigate the spread. Health officials in Los Angeles County say if they stay in the CDC's high-risk tier for 2 weeks, universal indoor masking is coming back. San Diego County health officials wouldn't go that far.
As far as locally, the strong recommendation stands, and we reinforce that every chance we get. Including right now, I'll be saying it more and we'll be saying it more strongly while we're in the red tier. The best chance to reduce your risk of serious disease is not to get it in the first place. Masks absolutely work.
In the high-risk tier, CDC officials recommend everyone wear masks indoors. UC San Diego Health infectious disease specialist Dr. Francesca Torriani says it's up to San Diegans to respond to the growing number of infections.
We should be using our judgment. Right? That is, I think, what public health is doing here. They are considering us as adults and as capable of judging our risk and making those decisions based on our personal risk.
Torriani says it's important for younger kids to also take precautions, especially with schools starting up again next month. Everyone 5 and older is eligible for 1 booster dose, and those over 50 can get an additional one.
People who are fully vaccinated and boosted right now, even in the teeth of BA.5, have half the risk of dying from COVID and half the risk of even getting it in the first place.
Health officials urge people to avoid large crowds, take parties outside, and stay home if feeling sick. For those testing positive, COVID treatments designed to lower the hospitalization risk are still available. San Diegans can call 211 for more info there. Matt Hoffman, KPBS News.